Here at Advanced Dentistry, we believe that healthy teeth start with education and establishing good habits. In this episode, dental assistant Michelle Maggart will talk about implants and bridges, how they work, and what the treatment protocol is. Let's meet Michelle.
So if you do happen to lose a tooth and you're interested in replacing it with an implant, this is what the implant will look like once it's been placed. This is a front tooth. It's the big front tooth on the left, so you can kind of gauge what it looks like. It's just a titanium post that goes up into the bone and just acts like the root of your tooth. This part that's sticking out here is what we will restore here in this office. So we'll put a crown over the top of that. This is the crown. Implant crowns have a metal base and a little screw hole that we screw the implant into. So that's what that looks like. The process start to finish is generally we'll send you to an oral surgeon and they will either extract the tooth that needs to be extracted, or if you already have one missing, you'll be evaluated for bone grafting. If you do an extraction and bone grafting or need bone grafting, you'll generally heal for 3 months and then come back to the oral surgeon and have the implant placed, which will heal for another 3 months before we put the permanent crown on the tooth. That's just to make sure that there's no damage done to the bone around the implant and it stays solid in your bone. We have temporary options so that you don't have to walk around toothless while this is all healing. So if you're interested in that, if it's a front tooth or something visible, we can restore that so you don't have to miss your tooth the whole time. And this is what it looks like when we prepare the tooth. We take an image and make sure that everything looks good. Dr. Johnson tests the implant multiple times along with the oral surgeon that we work with. So another replacement option if you're not interested in an implant is a bridge. So if you're missing a tooth in the middle, we just crown the tooth on either side of the tooth that is missing, and then there's just a fake floating tooth in the middle. This is what it looks like on an x-ray. These are really long bridges. We don't typically do them this long, but just for an example, you can see that there's a tooth here, and then 3 fake teeth in the middle there.
If you have any more questions about your treatment options, please do not hesitate to call us.
For more information, please contact us at 406-587-2201. Thanks for watching.